Okay, well, first of all, I'd like to thank all of you for coming on the call this evening. It's fantastic to try this technology and see how it will work. And so I will go through the presentation, and Trish, I'm hopeful that you have the set of slides that I sent to you. I'll move on to the next slide, and we'll get through this quite quickly.
Trish said she'll be here in a minute. It's working from home, so that's good.
Okay, great. Oh, there she is. I see her now. So, Jack, maybe I should give you a brief introduction. As we had discussed, Jack Boomer has more than 20 years of experience designing and managing projects and research, mostly in the area of health, and is a principal of Context Research. Jack is a strategist and facilitator and has established a comprehensive network of health professionals across British Columbia and Canada. Jack has worked with Clean Air Coalition of BC, which includes the Heart and Stroke Foundation and the BC Lung Association, since 1999. He has been the director of Quit Now services with the BC Lung Association since it was launched in 2004. He is working on tobacco cessation programs with other governments across Canada, including Alberta Health Services, the Manitoba Lung Association, and the Government of Nunavut on their and the Government of Nunavut on their cessation program. Jack is a member of the editorial board of Tobacco Info. Jack holds degrees from the University of Victoria and the University of Alberta. He is a professional member of the Canadian Association of Professional Speakers.
Well, thanks, Jamie. So Jamie and the team asked if I would do an update on e-cigarettes and provide my perspective in terms of e-cigarettes, which I am thrilled to do. What we're going to do is I'm going to whip through this deck of slides relatively quickly, and because we're a small group, I would like to open it up for questions. So if people have a question, if you want, you can just type the question in the chat box in the lower right-hand corner, and I can address it. Or if you want, you can cough or do something, and I will do my best to try to acknowledge and address the question. I also just want to mention that following my presentation, we've asked Trish Hill to share a bit of a perspective on IHA's policy regarding e-cigarettes and some of their thoughts. So the presentation today is going to be, it looks like there's a lot here, and there is, but I will, as I say, will be quite brief. We're going to provide a few facts. We said 2014 facts, but this is sort of some of the latest information about tobacco use. We're going to talk about some of the public health issues regarding e-cigarettes, some clinical or potential clinical issues, and a recommended clinical approach that is emerging related to e-cigarettes. As most people on the call know, nicotine is the addictive chemical in tobacco, and it takes just a moment to get to reach the brain, and that's why it's such a powerful addiction. And tobacco use remains one of the #1 causes of preventable death and illness in our society. And it far eclipses car accidents, diabetes, breast cancer, and prostate cancer combined. So on the chart here, you'll see the black stick man. That's how many in comparison to all the other cancers and car accidents and diabetes and combined. So it is truly tremendous. And if we can do something to assist people to quit smoking, we will make a significant difference in the lives of individuals and in British Columbians. The progress in Canada has been quite staggering. When we think of back to 1964, 50 years ago, when the U.S. Surgeon General released his seminal report about tobacco use and linked it to the fact that it does cause cancer and a variety of diseases. And so you can see that steadily overall that rates have fallen. You can see we've highlighted just a few things related to how prevalence has fallen and some of the stuff. This some of the programming. And overall, you see that consistently men smoke at a higher rate than women, and this includes daily and non-daily smokers as well. One of the things you can sort of see, though, starting in about 2002, is that the rates are sort of almost leveling off. There's still a little bit of a decline, but they're sort of leveling off. And so this whole issue of e-cigarettes is troubling, and perhaps is a bit of a concern. We know that with regards to smokers, that about 42% of smokers in Canada try to quit every year. But when you look at 7-month prevalence rates, which is sort of the standard in tobacco control, about 5% are successful. And so we need to be wrapping them with services and supports that will assist them to quit. We know that most people who try to quit are unsuccessful, as we just showed, but we know that many people have an intention to quit and they want to keep trying. So that in the next 30 days, we know that approximately 3 out of 10 smokers want to quit in the next 30 days, and sometimes they need to be inspired, and that in the next 6 months, it's about 2 out of every 3 smokers would like to quit in the next 6 months. So that's their intention to quit, rather than things moving. It looks like, are my slides advancing?
No.
Are you still on the first slide?
Yes.
Yeah, we are.
I apologize.
Not sure what's going on there.
Uh-oh. So
I
on
wasn't
my
sure if you meant to be on the first slide or not.
no. Well, Jamie, can you advance the slides?
I'm not sure I can, actually, because it's your screen that's showing. Are you able to? Oh.
There. Do you see e-cigarettes?
Yeah.
Okay. So I apologize. So do you see the next one? Here we go.
Sometimes it takes a moment for them to load. I've noticed on other webinars, but no, it's not. Oh, there we go. The addiction. Yep.
Okay. So these are great slides. So I'm just going to quickly review them again. So nicotine is the addiction. It gets to your brain quickly. Regards to, here's the stickmen here that show how many, in comparison to all the other car accidents, diabetes, breast cancer, and prostate cancer, tobacco, which would include heart disease and the varying ranges of cancers like lung disease and heart disease combined. Here's the chart about the progress of smoking prevalence in Canada, and you can see that starting in the 1964, the rates were upwards of 60%, and now we're hovering in Canada right around the 20% mark, and for women it's about 17%. Quit attempts, 42% of smokers in Canada try to quit every year, and 5% are successful. And most of the ones who don't succeed do keep trying. That if they want to quit in the next 30 days, about 31% have an intention to quit in the next 30 days, and about 2/3 want to quit in the next 6 months. In terms of abstinence rates for cessation strategies, what we do know is that telephone counseling and online support will make a difference. So people who try to quit without any support, the abstinence rates, easy for me to say, are right in the range of 8.5% with no counseling or no support. Whereas if they get counseling or if they combine it with medication, patch, gum, NRT, or Champix or Zyban pharmacotherapies, that will increase their chances of being successful. And when you combine behavioral counseling with medication, it's upwards of 27%. So truly, cessation will make a difference if you have the behavioral counseling. So really what I understand you wanted some information about is e-cigarettes. And so we've heard about e-cigarettes. This is sort of a standard one. In fact, this one sort of looks like the blue cigarette, although the blue e-cigarette is extremely cool. If I was smoking, I would want to use the blue because they're long black. They almost look like a very sophisticated pen. They have 3 components: the cartridge, the atomizer, and a battery. And what they contain is often referred to as e-juice. And it can contain everything from nicotine, although we know in Canada that they're not supposed to contain nicotine because Health Canada has a warning about that, that they're not supposed to be sold with nicotine in them. But they include a whole range of chemicals, flavors, propylethylene glycol, polyethylene 40, yeah. So, and that they can range in price from $60 to $150 for a starter kit. But one of the things regarding them is once you have the starter kit, it's relatively inexpensive to buy the the juice and to so the 5 cartridge package for the juice, and it will last a while. So Health Canada in 2009 had a position statement on e-cigarettes, and they basically stated that that e-cigarettes are not approved for use if they contain nicotine. However, you can go to just about any community, and if you ask around, you will be able to find the folk who sell the e-cigarette with the e-juice that has nicotine in it. Sorry? Oh, somebody was unmuted. And that, in fact, the Lung Association in 2012 called for research, regulation, and clean air bylaws. And but the other thing around Health Canada is that you're not really allowed to make health claims related to the e-cigarette in terms of assisting people to help them to quit smoking. And because that's really what a lot of people buy them for. So in 2014, this is what we know about e-cigarettes. It's a relatively new product. It's less than 10 years old. It's a heterogeneous product, and what we mean by that is there are hundreds of brands out there, and there is no regulation around what is in the e-juice. So some could flavor it more with more propylethylene glycol or different flavorings or different things, chemicals to make it unique. So the ingredients and flavorants and amount of nicotine vary widely. There are many, many brands available, many of them on the internet. I don't know about you, but for a while there, on a weekly basis, I was getting introduced to somebody from overseas, often from China, inviting me to purchase e-cigarettes. And there are a few brands, though, that account for the bulk of sales, which would be Blue, Envy, Enjoy. Those are just a few of the brands that are probably account for a lot of the sales. What we're also seeing, though, is that there's an increased use of e-cigarettes. Approximately 20% of smokers reported that they had tried e-cigarettes in 2012, and some of this data is from the States, and that increasingly in the U.S. In 2013 there was about $2 billion worth of e-cigarettes sold. And while that's a fraction of the conventional cigarette market, as we see, and as I'll talk a little bit about, you can see that there's a real opportunity if you were owning a tobacco company, how you might want to be getting involved in the whole e-cigarette business. So I'm going to switch for just a moment and talk about 4 key issues, real public health issues related to the risk for youth, dual use, just touch a bit on secondhand e-vapor, and the fact that they are unregulated. So first and foremost, again, a lot of this data comes from the United States. The United States Center for Disease Control reported the doubling of e-cigarette use among middle and high school students between 2011 and 2012. So I think in 2011 it was around 3%, and so it was up to 6%. So, oh no, it was 4.5% up to 10%, as we see in the next bullet. Current e-cigarette use increased from 1.5% to 2.8%. So again, not overwhelmingly like huge numbers, but it is a troubling trend when things are doubling, and the potential is there to double. 80% of these e-cigarette users also smoke conventional cigarettes. So oftentimes there are numerous reports, and Louise sends me articles now and then about e-cigarette users at school, and they talk about the fact that they'll use them in classes, even though the school will have policies, but they show how they're using e-cigarettes in classes or in the washrooms at schools. In particular, this was an article from Colorado, I believe. And we also know that some of them are putting other things in the e-juice, such as marijuana, but that's a whole other discussion. So e-cigarettes are readily available to you through the internet. We know that, and as I mentioned, I get a number of emails from people about that. And there is a wide variety of flavors. If we brainstormed 10 flavors, I would be surprised if those are not all available in terms of the e-juice that you can see them. So that the whole issue of the risk for youth is troubling. And in fact, one of the things that I'm just going to switch to another screen here, because just before the presentation, Louise sent me a picture. And can you see the picture of the primetime cigarettes and the regular cigarettes and how all these packages look like candy? Can people see that?
Yeah, we can see those.
Okay. So you can see that if you were a marketer, you would want to be creating products that would appeal to youth because they're the next market. So again, that is quite troubling. But I've heard of people, they buy the various flavors and they'll mix chocolate with pina colada and different flavors, so you can sort of customize the e-juice. And it truly is quite interesting. Again, this is some data from the States from last year, 2013, in terms of their perception of e-cigarette use.
Hi, Jack.
I'm not going to go into a lot of detail. Yeah.
Janet had a question, is what is in the e-juice listed on the juice pack?
Yeah, sorry, Jack, I missed that if you'd mentioned it.
No, I didn't mention it. You know what? I'm not 100% sure, but I would expect that they would be disclosing some of the flavorings and or sorry, some of the things that are in the e-juice. But I'll be talking a little bit about the other types of chemicals that are found. But Trish or Louise, do you know if they disclose the list of ingredients on the side of the e-juice?
I think they're still muted.
Oh, yeah, sorry, I'll fix that. I'm just going to unmute everybody. There we go. Oh, no, I'm having trouble unmuting Trish.
Louise, do you know if they list the ingredients on the sides of the packages?
I know they put some of the stuff in there, but not, I think, what is actually in the e-juice. I'm just looking for my slide that talks about, and maybe you had that, you know, it's the nicotine, the water, the flavoring.
Yeah. Yeah,
It's Trish here. Can you hear me?
Yeah.
Yeah.
Hooray! That's great. Yeah, I have an e-cigarette that doesn't have the ingredients listed on it, and I think there is a slide coming up in this presentation about things that are detected in addition to sort of the run-of-the-mill ingredients as well.
Yeah. I think Janet. Sorry?
They don't have to indicate if there is some nicotine?
Well, I think the issue is that if they're in Canada, they're technically not supposed to sell it with any nicotine in it. However, the enforcement may be a little bit less than rigorous in terms of the whole e-cigarette issue, and everyone is hoping that Health Canada would take a bit more aggressive stand. And we have heard that they've sent letters to people who are selling e-cigarettes to say you're not allowed to sell them if they have nicotine in them. But there was some media in Victoria about that, and just saying it's a sort of a gray area, and I haven't heard anything further about that. I also think, though, that if with some of the e-cigarettes, they would put the manufacturers could list the ingredients, but it might be in 3 font, so it would be so tiny that you would hardly be able to read it anyways.
And also, Jack, nicotine has been detected in e-cigarettes that say they don't contain nicotine. So that's another issue as well. And just to add from the Kootenay Boundary perspective, e-cigarettes with nicotine are available at retail stores. There was some media work done at Christmas time about this, or just after Christmas. And there's a local computer store in Nelson that sells nicotine e-cigarettes. And those are sourced through somebody who's in Trail, who brings them up from the States.
And they are just sold to anyone? There's no age restriction on them?
There are no regulations around sales to minors, no.
That's sneaky monkeys.
So people, so people may self-regulate, but there are no regulations upon them, no.
Huh.
So, good questions. So in terms of youth perception of e-cigarettes, do you have this slide in front of you?
Yep.
Yeah.
Okay, so I'm just going to highlight So some research that was done in the last couple of years about why do youth use e-cigarettes, and so 40% say it's expeditious consumption and concealment, so that they're smoking them in places and that it's easier than smoking a regular cigarette, again as my example from the high school, and that there appears to be fairly high social approval. So this isn't a ginormous sample. There were about 35 to 40 in this sample, but it gives you sort of a sense of the whole e-cigarette use. What are the places that you use the electronic cigarettes? And some people say everywhere. 4 out of 10 were indicating just about everywhere. And then the school bathroom, 1 out of 4 are smoking in the bathroom. Brings back that song from the 70s. Anyway, what do your friends think about electronic cigarettes? And there's 50% indicate high social approval and that it's healthier than a regular cigarette. And why are they so popular? Well, accessibility. And again, as Trish mentioned, there are no regulations in terms of who can purchase them. So a 5-year-old could actually go in and purchase an e-cigarette and it would be perfectly legal. And then the whole belief that they are healthier than cigarettes, and then some other factors there. So we've talked a little bit about youth, and I want to just switch gears a little bit to talk about dual use. So one of the things that is kind of interesting is that you have this whole pool of people. They're desperate to quit smoking, so they're looking at alternatives, and we know that a lot of people, 31% have indicated they want to quit in the next 30 days, and 2 out of 3 smokers indicate they want to quit in the next 6 months. So the intention for them is high. So they may go out and purchase e-cigarettes, but again, because there's no regulations even around that there should or shouldn't be nicotine in it, so they're not even getting the hit from the nicotine if they don't have the nicotine in it. But in many instances, they're being marketed as a way to help people quit smoking, even though they cannot make that health claim that it is a cessation aid, because there's really been no tests or full trials or long-term studies done on this. But most users still smoke conventional cigarettes. So what they found is that 75% of users reported that they are also smokers, so that they're smoking both e-cigarettes and regular cigarettes. And about 1 out of 10 reported they were former smokers and used cigarettes exclusively. And this is troubling because in a future slide we'll see that there are typically now more ex-smokers than there are smokers. And we have data from the States, but in Canada it would be the same. We have more ex-smokers than current smokers. And so here's a huge pool of folk who maybe really liked smoking, but they quit for health reasons or for a variety of other reasons, and they may be starting to say, gee, maybe I can do the e-cigarette thing, it might be healthier for me, I can get that hit of nicotine and enjoy it again, and it might be more socially acceptable. And again, about 3% of users reported that they were never smokers and used e-cigarettes exclusively, so that they are sort of the untapped masses of a new market and think that it's cool to be smoking the e-cigarettes. So one of the questions is, or issues is, regarding dual use of e-cigs and conventional cigarettes, is that if a smoker contemplating quitting conventional cigarettes instead begins to use e-cigarettes as a harm reduction strategy, it may prolong the use of conventional cigarettes. So rather than quitting or really quitting, they'll say, well, gee, I can switch to e-cigarettes, and that will be likely less harmful, but maybe it will prolong their use of a product and it may promote relapse. Many risks of smoking cigarettes are not dose dependent, so that's an issue. And then any continued smoking of conventional cigarettes in a dual user may prolong his or her health risks. So that's one of the issues, is that if we're going to move down this dual use, what are some of the implications for people smoking both the e-cigarettes and conventional cigarettes, if indeed they are contemplating quitting altogether? So do e-cigarettes lead to relapse for former smokers? Well, it's limited data on this, but you saw a previous slide about 12% of e-cigarette users were former smokers. So this potentially could be a huge concern in terms of relapse. One of the big questions comes up is then, are e-cigarettes effective for cessation? And there are a few studies that have shown that e-cigarettes may assist, but there's a few studies that show they don't really assist. The results are all over the map. And that's one of the challenges with such a new product, is that there just is not enough data out there. There are some studies that show cessation effectiveness is about equal to the patch and gum. But again, one of the concerns, in particular in the United States, and I am actually borrowing slides from Dr. Michael Fiore, who is sort of the god of tobacco control or cessation in the United States. Due to limited cessation data, neither the U.S. Public Health Service nor Preventative Service Clinical Task Force has recommended e-cigarettes as a cessation aid to assist with quitting smoking. Because, again, the other issue is that there's no long-term safety data. So while it appears that they are safer, and I'll show you a slide that shows, likely the amount of chemicals and the toxic chemicals are much, there are less toxic chemicals in e-cigarettes than regular cigarettes because of the lack of regulation and because of the lack of long-term data. We don't know what the implications are for people's health. So again, here's a graphic slide about e-cigarettes versus nicotine and patch. And basically, I believe it's the blue on top is the nicotine e-cigarettes, and then the patch and gum is the red, and then the green is the placebo e-cigarettes, which I believe did not have any nicotine in them. And you can sort of see that at about 200 days, the patch and the patches, or sorry, the patch and the e-cigarettes are sort of about similar in terms of assisting people to quit. But the evidence is inconclusive. But on the flip side, it might be that the e-cigarettes might assist people to quit. And so I don't think that we should be completely closed to that idea of the e-cigarettes, but we just don't know fully. And again, the data is a bit inconclusive.
It would be interesting, Jack, to have on that slide like a line for people trying to quit with nothing. Because I thought part of the thing with e-cigarettes was just the habit and the motion. It would be interesting. Yeah.
Absolutely. And I think this is the conundrum for people in the tobacco control community, is the fact that, when you look at this slide and you go, you know what, if it's sort of equal to the patch, this is actually maybe a really good thing, and that it's better than people quitting cold turkey. And so maybe we shouldn't be completely negative about the whole e-cigarette thing, but there are so many unknowns. The other thing is that the public is way ahead of the public health community on this. They want help. They've seen a product. They believe it will help them. And if you talk to people who use e-cigarettes, they'll say, I'm breathing better. I can go up the stairs. I used to wheeze when I went up the stairs. So anecdotally, people have these stories. But when you look at the research, it's a little bit over the map. So, and that's why when I present this, I don't want to completely discredit e-cigarettes, because there is the potential, and we may need to, it's been called a disruptive innovation, and that it disrupts our thinking, because up to a couple of years ago, it was get rid of cigarettes altogether, and now we're being faced with this challenge that there may be a safe product, safe nicotine delivery device that may assist those, that will reduce death, disability, and disease. And so what should the public health community's response be to that? So I'm going to present a few slides on very quickly about secondhand e-vapor, because I just think it's in this whole era of e-cigarette use and secondhand smoke rules and regulations and outdoor bylaws, and it's just something I wanted to touch on.
Hey,
Little is
Jack.
known about secondhand smoke. Yeah.
Sorry to interrupt. I have a bit of a concern. I think because I started the webinar early, when I asked Division Central to set it up, the tech support there told me that the length of the length of time that we take doesn't matter, but I am seeing the duration counter counting down to 6 minutes now. So I'm hoping that we're not going to be cut off, but I just wanted to interject here and let you know that I think there's a possibility we may have only about 5 or 6 minutes left. I apologize for this. I've been trying to change the length of the session in the account login, but it's not allowing me to do that. So we'll see what happens, I guess. But I'm hoping that it will just continue on after that 60-minute period is elapsed.
Okay, well, I'll try to speak very quickly, and if nothing else, I can send a PDF of the slides to everyone, and you know, I know, and you can go through it because we've included a lot of text on. They're very text-heavy slides for people in case people couldn't attend. But really, what I wanted to say about secondhand e-vapor is that little is known about the exposure. There's been some studies done around the ingestion of nicotine, volatile chemicals. There's some concern for youth and pregnant women, but there's the question comes up about renormalizing or reglamorizing smoking if people are allowed to smoke in places where there have been clean air bylaws put into place. And so the issue is, should we be talking about clean indoor air, or we should be, or the standard should be clean indoor air, not less dirty air around that. This slide is a little bit, it's not that complicated, but really the bottom line is, on the left-hand side you'll see a list of the toxic compounds. With a conventional cigarette, this is micrograms of exposure in terms of formaldehyde, and then with an e-cigarette, for every 15 puffs. And when you look at the right-hand side, you'll see the red column of numbers. And basically what this shows is that a conventional cigarette is twice as harmful in terms of the number of chemicals around formaldehyde than an electronic cigarette. And when you're looking at acetaldehyde, it's 130 times more, potentially more dangerous than an electronic cigarette. So when you start looking at the numbers in terms of the toxicity, you see a wide range in terms of everything from 2 to 145 times more harmful a conventional cigarette is to an e-cigarette. And so but again, as has been brought up before, there's no regulation around what can be in an e-cigarette or what can be in the e-juice. And so it's up to the manufacturers, sort of like the Wild West in terms of what will be included in the e-cigarette juice. The other thing that's of concern, this just came out this week, is that the number of calls to the poison control centers in the United States have gone from 1 call a month in September 2010 regarding e-cigarettes to 215 calls a month around e-cigarettes, because what is happening is, in particular young children under the age of 5, they're seeing these vials, oftentimes they're colorful, and they may be doing something with they're ingesting the e-cigarette juice, and so there have been a dramatic, like an exponential number of calls related to e-cigarettes. So this is troubling, as you can see. I mean, it's just unbelievable, actually. So what I wanted to do very quickly then is shift the discussion to physicians discussing quitting, and this leads into the guidelines, which I'll go very, very quickly. Smokers can quit with the right help, yet in Canada, only 4 out of 10 physicians have talked about quitting, or 41% of smokers have discussed quitting with their family physician in the past 2 years. That means there's an opportunity of 59% have not. And so if a physician were to ask and encourage people to quit smoking, it could make a tremendous difference. The effect of a physician intervention is huge, that if a physician will do some intervention, it can double the chances of somebody quitting, but just doing it on their own versus a physician's intervention. So as I mentioned, Dr. Michael Fiore did a presentation a while ago, actually about 2 or 3 weeks ago, and I asked if I could share his approach. And these are some guidelines around e-cigarette use. So we know that patients are asking about e-cigarettes, and that a 5-step clinical approach using the limited evidence is recommended. And so this is the big sell here. Are people still on the line?
Yep.
Okay, great. So the first approach is for a physician or a healthcare professional to say, look, if tobacco products, whether it's combustible or smokeless, it can be harmful. But combustion tobacco use is by far the most harmful. So if somebody is smoking using a conventional cigarette, that's the harmful, the ultimate level of harm in terms of using tobacco. So that should be clearly noted. That the clinical approach should be to strongly encourage the patients to stop using any combustible or smokeless tobacco product. But if the smoker is unwilling to make a quit, and if they are willing to make a quit attempt, there are evidence-based treatments like patch gum, physician advice, the quit line counseling, and this is, again, these are guidelines from the United States, but they would be basically similar in Canada. That there are these evidence-based treatments. You can refer them to Quit Now. We do follow evidence-based practice based on the North American Consortium of Quit Lines. The website, we have text programs, all evidence-based to assist people to quit. That if the patient is not willing to make a quit attempt, maybe the urge the smoker to smoke combustibles as little as possible, or to explore strategies for them to reduce smoking, such as not smoking in the home or the car. Let them know about NRT that may reduce combustible use and help them to quit. And again, in British Columbia, we have the best NRT program in Canada. People can call 811 to get up to 12 weeks of free patch and gum, or they can go to their physician and often get reduced costs to get Champix or Zyban, depending on where they are in the product formulary. And inform them that there are many forms of approved NRT that can reduce the urge to smoke. This fourth step is, when discussing cigarette substitutes, many patients may propose using e-cigarettes. Inform the patient that the health effects are not known, but that e-cigarettes are likely safer than combustible tobacco products. So it's a very practical approach. They're likely safer. If they cannot stop or greatly reduce their smoking, using NRT or behavioral strategies, the patient may decide to try e-cigarettes, and that to emphasize that the ultimate goal must be complete cessation of combustible cigarette use in order to protect their long-term health. And that dual use, as we've mentioned, is not a good long-term goal to be doing the two. And then last but not least, in terms of the fifth step, is that over time the clinician should monitor the patient's success in eliminating combustible tobacco use and assist the patient in achieving complete cessation of all tobacco products. So the bottom line is to use a very practical approach, that is, counsel them that it's bad, that smoking is harmful, that if they want to quit, there's evidence-based approaches. If they want to use e-cigarettes, let them know, well, try better. Whoop. Okay, well, people are still in the line. Okay, so again, just wanted to highlight, and I'm going quite quickly here, that this is sort of a bit of a summary of some local survey data around e-cigarette use, that there's progressive use.
I just wanted to say, Jack, it does look like they are allowing us to go over, so there's no urgency to rush if you're worried about that.
Okay. So this slide really is just meant to be a summary. There was a survey done by some folk that we work with in the pharmaceutical companies, and basically what they found was that there is a progressive use in e-cigarettes, and people are using it for cessation, and it is surpassing the use of patch gum and other types of medication like Champix and Zyban. That they're doing dual use, and there really may not be any reduction in the consumption of tobacco, and that the experience with quitters is that many of the quitters have some experience with e-cigarettes, and that people are looking to healthcare providers for information on e-cigarettes. And one of the reasons why people stop using e-cigarettes is because they may be ineffective at reducing cravings, and I think that may be because there's often no nicotine, or there shouldn't be nicotine in them, or the levels of nicotine are not consistent. Because I've asked people about their purchase of the nicotine, and it varies. Some will buy the 21 milligram nicotine in their e-juice, but again, because, and 14 and 7 is sort of mirroring the patches, but it could be a little bit all over the map there. So in sum, that current science to inform decision making is limited on e-cigarettes, but the public is way ahead. What I presented to you is what we know, and truthfully, every day there is more information coming out about e-cigarettes. That, to be very practical, that there are some guidelines to assist people around using e-cigarettes or encouraging people to quit smoking combustible cigarettes. And so one of the best things that I could encourage people to do is that if they do have patients that want to quit smoking, is to refer them to Quit Now. We have online fax referrals. We have fax referrals, the regular standard fax referrals, or refer them to quitnow.ca to assist them to quit. And there is a picture of me and just my contact information in terms of how to get in touch with me. So I'm going to open it up for discussions because when I changed the slides, I may have missed people asking questions because somehow it changed this slide view for me. So Jamie, I think Trish was going to do some discussion, but maybe we can open it up for questions.
Yeah, Trish had asked if she could say a few words. I do have her unmuted, so Trish, I don't know
I'm
if you.
here.
Yeah. Okay. Great. Did you want to go ahead, or Janet? Do you have any questions first?
I have a couple questions. So is the FDA looking, like, where is this in the whole process? Is it not even on the radar, or is it in the process, or is there, like, where is it?
What do you mean, the FDA?
Well, in terms of regulating it as a medication with a specified nicotine dose that could, I know they don't regulate cigarettes, but if this is going to be marketed as a type of quitting tool, like a nicotine patch, like, those are FDA regulated, I think.
Yes, I think the issue is that in some ways the horse is out of the barn, and that if you go into a pharmacy, you will actually see that the e-cigarettes are being marketed beside the patch and gum. And I spoke to the College of Pharmacy Association, or the College of Pharmacists last week about this issue, and you know, this is a concern when a product is being placed with patch and gum. So by inference, I think the public is going, well, gee, it must be like the patch and gum. So they don't even have to give any, that nobody has to say anything about the health claims because it's being marketed that way, even though there's no health claim, there are not supposed to be any health claims on it. And, you know, if I was with any company, you know, you want to get your product out there unless you're really trying to assist people to quit smoking. And so...
Jack, can I add something to that about the FDA?
Sure.
The FDA actually has been saying for many months that they are on the verge of regulating electronic cigarettes. They actually do regulate tobacco products, the FDA in the U.S., and so they keep teasing us and saying, well, we're going to be releasing regulations around e-cigarettes very soon. And they're taking a lot of flack because, as Jack says, the horse is out of the barn. The tobacco companies are marketing these very vigorously. They've bought up the vast majority of companies who are developing their own e-cigarette companies. And so the public, I'm not sure if they're ahead of public health officials or if they are being inundated by marketing messages from tobacco companies about them, such as you can smoke these things anywhere, they won't hurt you, all they have is water vapor in them. So the FDA is taking a heck of a lot of flack about that, and I think Health Canada has also been extraordinarily silent on regulation in Canada. But places like the UK and the EU have regulated e-cigarettes. In the UK, they're regulating them as medicines, which I think may be different from the US. And they have banned sales to minors, and I think the EU has as well. So that's where it is in the process. I've got one of those alerts with the FDA where they send me any kind of regulations that they have to do with tobacco products, and I keep waiting for the e-cigarette regulation, and it just hasn't come along yet.
Well, because it's interesting, because as a physician, if I were going to recommend it and there was a whole bunch of unregulated products and one where I knew what I was getting, I would recommend that one.
Yeah.
But also, it might be useful to have the ability to prescribe it to minors if it's helping them quit smoking, like if it really does decrease their risk of cancers and things like that, I would, like, there's lots of 12 and 13-year-olds smoking, and they can't. Can minors buy nicotine replacement, or is it behind the counter?
No, it's on the shelf. Minors can buy nicotine replacement therapy, and just a word about what Dr. Michael Fiore recommends. He did say on his webinar where he gave these recommendations that he could never recommend e-cigarettes to a patient. He said, I just have too many concerns about these things, but patients are asking and they're saying that they are going to go ahead and use them. So in that case, what he does is to say, okay, if you're going to use these products with their, lack of safety data and lack of effectiveness data, what you need to make sure you're doing is establishing a goal of complete cessation. Do not use these things along with conventional tobacco products, because if you cut down cigarette use and just keep smoking for years and years rather than quitting, then you have, the health impacts are huge, are substantial, right? So he does not recommend using e-cigarettes. So I wouldn't want you to get the impression that that's what he was saying. But he just says that the marketing of these things is so overwhelming that people are getting the impression, and they're doing this out of the goodness of their heart. They have great intentions, and people do think that they are the best thing since sliced bread. But what we see from the cessation, the graph that Jack showed us earlier, is that in the early days, it does seem as though nicotine e-cigarettes help people to stay abstinent. And so there may be sort of an increase in confidence that this is an effective cessation tool, which doesn't actually end up being particularly helpful. So I agree with you. If you have something that is proven, that is safe, that is standard, that is available for free through a government program, then that seems to be the way that we would hope people would go. But if people are using e-cigarettes, then they need to be sure that they're not smoking them indoors, they're not smoking them around their kids, they're not smoking them in smoke-free environments and other places, because they are, they do give off fine particulate matter and these toxic compounds, even if they're in smaller amounts than combustible tobacco, they're giving them off. So if people are using them indoors, which I'm hearing from nurses in the Nurse Family Partnership, I was talking to them about e-cigarettes a while ago, and they said that, mothers are using them indoors around their infants and babies because they think that they're just giving off water vapor, whereas if they were smoking conventional tobacco, they would smoke that outside.
That's what I thought, actually, until tonight.
Yeah, as did we all, right?
Yeah.
Just one other little local story I have for you is I had a call from a mother in Trail about a month ago whose 13-year-old son had come home from hockey practice and said, these e-cigarettes are really popular with the members of my team. I'd like to get one. So she called me up. She's an Interior Health employee, and she phoned me and said, do you have any concerns about these? I said, yes. Kids who are modeling, this is the novelty thing, doing all of these hand-to-mouth movements, creating vapor, stimulating smoking, and potentially getting nicotine and setting up an addiction is just not
great.
Is
this being done at the schools, this education, like to the students as well?
Yes, so we're frantically, I should say, methodically working at getting information out to schools and school districts about this, and also information out to our own staff in Interior Health. And on that note, just to let you know that the Interior Health smoke-free policy is being revised for a couple of reasons, being updated, and also to include a prohibition on e-cigarettes. Because we've had patients saying, can I bring my e-cigarette in when I am coming in for surgery? But, we can't have these products in our indoor smoke-free environments, potentially triggering, the person at the next bed who's trying to quit smoking. And so we're doing these revisions and the update to the policy, and also a big education campaign for our own staff. So, yeah, I mean, nicotine replacement therapy is on IH formulary, and we also have some materials. Janet, I don't know if you've seen the rack cards, the Stop Smoking Before Surgery one.
No.
So I can send you some of those. They're great for just reminding people who are going into hospital that if they are able to stop smoking and use some other methods to, 6 to 8 weeks before surgery, or even any time up to surgery, that can really have a huge impact on their, risk of complications and their healing time, and even the length of stay. So, yeah, we're hoping to get...
Are they being given out at the pre-op clinics already?
They are being given out at the pre-op clinics, and we're trying to get as many people as possible to hand these to patients. So family physicians and surgeons and the pre-op clinics, anywhere we can provide these. So I'll send some to you.
Yeah, that'd be great.
I just want to jump in there. I was at an alternate school today and talked to about 4 or 5 kids. One had just quit smoking. These guys are 15, 16 years old. One 15-year-old had a patch on. He has a cigarette. He usually smokes a pack to a pack and a half a day, and he's trying to quit. And he smokes a cigarette in the morning until his patch kicks in. Like, he's kind of got it figured out, but he still says, I feel like smoking. So we talked a lot about that, because when he phoned the 811 number, they said, well, you're 15, you shouldn't be, really using these things. But, for kids that are smoking that much, it's way better to be on the patch than to go back to the smoking. But this kid was great, and he was interested. Like, we did carbon monoxide testing, and he could see that he was coming down from when he'd done it before, because I've been to the class before, and he was offering to come with me to another school to talk about it with other kids, which is great. And when we talked about e-cigarettes, he said, I heard that stuff is poison. So word's getting out about a few things, which is great. He says, no, the stuff that's in it goes around the tar that's in your lungs, so there's no way that the tar can break up. So, I mean, the stories are going around, but at least they're getting some of the message that, they're not as safe as claimed to be. And I just want to add, too, that if there's ever an opportunity, or you would like, Janet, for Trish and I to come and do rounds in the Kootenay Boundary area or somewhere and talk more about this, we're happy to give the same sort of similar presentation.
I was just thinking that, actually. And Dave Scott's here with me. He works in the respiratory department in Trail, and they get sessions with Quit Now as well. Do they get the same stuff?
What do you mean sessions? Like as in education?
Dave?
We do. I think there's just a bit of miscommunication. We get sessions with ResTrack, which is, I think out of Saskatchewan, that gives seminars on, and I believe we just have one on the agenda for smoking cessation. And of course, they also offer COPD and asthma education and other sorts of things like that. So.
Are you, yeah, I think there would be an interest in it in our hospital for sure. If I can get your emails, we can talk time.
Sure. I mean, I know I've done Quit Now rounds before in Nelson with the doctors, and Trish and I are kind of doing this duo road show, which has been great, and we've hit a lot of healthcare providers like diabetes educators, nutritionists, and public health nurses, because they're all getting asked the questions too and wondering what to say especially about the e-cigarettes. So I'm happy to, maybe Jamie can connect the two of us via email, and I'll get in touch with you about it.
I'm doing that right now, yeah.
That'd be great.
Okay.
And David, one of the things, it's great to, if you're getting some of the education, and what would also be helpful is if at the end of it there's some information about Quit Now and the fax referral program and the free services that are available to British Columbians that you can refer. Because one of the things is that we hear sometimes is that that if the healthcare professional, they can take the person to the first 3 A's, ask, assist, and advise, and almost even arrange, and that is to do the fax referral and get them to us, then we can take it from there and build the bit of the relationship in terms of the behavioral counseling. That's the phone counseling, or get online. They can do web stuff. We have a text program, 14 weeks of text, and that's something that Trish and Louise can share about the Quit Now program. Again, it's free to British Columbians, and we also get the free patch and gum in British Columbia, or we do. So it's great to highlight those made in BC services, and it's great that you're getting additional education about helping people to quit smoking.
Yeah. Well, we've really moved from what we used to do. I mean, we're all smoking cessation counselors that we've taken the training, but we've kind of over the last couple of years moved on from doing outpatient or even inpatient counseling, and have instead concentrated our efforts on brief interventions, and then providing the information to contact Quit Now. Although we were doing that fax referral a year or so ago, but it seems to have tailed off now. I'm not sure why, but we're each and every session with every smoker always ends with handing a brochure or a booklet of Quit Now to the patient with the 811 number. But the fax referral seems to have dropped off. Is that still what you would prefer, as opposed to just the kind of the verbal sort of and brochure referral?
Well, I can speak for me, and that is that the one thing is if you can get the fax referral, about 30% of those people will actually enroll in the program. And what happens is it's sort of like, I hate to, it's one of these things where people will take the brochure and the information, but at that point, of course, they're in the hospital. They're going to do everything to improve their health. They're going to lose weight. They're going to go walking. They're going to eat healthy, 5 fruits and vegetables a day, and they're going to quit smoking. And then they get out of the hospital, and then that motivation plummets. And so one of the things by doing the fax referral, if you can, what that does is it may inspire people because we do the follow-up, we do the calling, we then sort of perhaps move them to that stage of the next step and getting some assistance. And again, 3 out of 10, that's not too bad in terms of perhaps them enrolling and making a serious quit attempt.
Mm-hmm.
And
I'm always wondering if the reason that the regular therapists have dropped off is that we have a respiratory therapist in the hospital through the Breathe Easy that monitors all inpatients and flags their smoking, and I'm wondering if she's taking care of all that fax referrals, but I'll check into that just to make sure.
Well, and maybe Louise can follow up with you on that directly, because she's or Trish, in terms of encouraging people to do the fax referrals. So
that's Kelly, Dave?
Yes.
Yes, yeah, for sure. I wouldn't be surprised if Breathe Well has that capacity, but it's great if all of the respiratory therapists are doing brief interventions and fax referrals as well. But we can, yeah, we'd love to come and talk to your group at the hospital about e-cigarettes and just a quick update on Quit Now. Anytime.
I think there's.
Go ahead.
I was just going to say, with the Quit Now, like there's a texting program now, and there's Facebook, and there's lots of ways that we're trying to make it as useful and fun for the people who are trying to quit, and even those patients who are outpatients. I always say, you hand somebody a brochure and they kind of look at it and, put it down on the counter. But if they actually get a phone call and say, oh, I hear you're interested in quitting smoking, they're much more likely to say, yeah, maybe, in a month's time, and Quit Now will call them back. Whereas if they don't have that phone call, they have to make the phone call. So I really try to encourage people to make that fax referral with their clients, just to say, you don't have to say yes right away that you want to quit, but when we're there, when you're ready, we're there.
Yeah, for sure.
Well, I want to thank you for the opportunity to speak this evening and to try out the webinar link. I think it's been great. And I'd like to thank Jamie, and I'd like to thank Trish and Louise for helping organize this in collaboration with Jamie. And we look forward to tomorrow getting 10 or 15 fax referrals between David and Janet. This month we're offering a special deal of you get 25 fax referrals in, and who knows what you might get as a special prize.
Vegas, I hear.
Vegas is 10,000.
Oh.
No problem.
There you go.
Thank you very much.
We also did. Yeah.
Oh, sorry. Go ahead.
We also didn't talk about the Tobacco-Free Tuesdays, which is the first Tuesday of every month that we encourage people to sign up to try and quit smoking, and they have to go onto the Quit Now website to do that. So they're on that site, and I think we get 500 or 600 people a month trying that, and they just like the incentive, and some of the prizes are like a $250 gift certificate to Future Shop or something, and they like that sort of incentive, so it gets them at least trying to quit, which is part of the process. So,
and they only have to quit for 24 hours.
And nobody checks.
I'm going to start smoking so I can quit.
Is that under the same program as the No Pants Fridays?
Yeah, Dave gets prizes for his No Pants Friday.
Okay, we're coming on Friday to do the round.
Yeah.
Anyway, I see that Jamie has connected Janet and I, and maybe Janet, you can connect us with the respiratory therapist, and hopefully we can do a joint thing. I connect with Greg Rollins fairly often, so it would be great if we could do a session there for sure.
Yeah, and our rounds are all open, so we could have everyone, their docs and the rest. And all,
Great.
All the
Great.
want to come? Yeah. Thanks, guys.
Yeah, thanks
Look
for
forward to it.
Yeah,
Look forward to it.
thanks
Thanks
very
for
much.
coming out.